organ donations and transplantations. And we're talking to Doctors Faulkner and Stevenson. And of course, Dr. Faulkner, before we had our break, we were talking about some of the problems associated with transplantations and kidney diseases. And I think that it's well known that the price of keeping a person on dialysis is a very, very expensive proposition. Let's have you to talk about the Kidney Foundation and some of the things that you're doing in terms of trying to lower that cost.
Okay. Well, Meharry has been working with the Kidney Foundation for the past 2 years. And under our MOTEP program that we received from Howard, we will continue to work with the Kidney Foundation in trying to educate minorities about organ donation, as well as Tennessee Donor Services. As a matter of fact, we have had a meeting now. We've had one meeting where all of us have come together to move towards one unified educational program for minorities. And that is going to include education on hypertension, education on diabetes, education on organ donation, education on bone marrow transplantation as well. So we are looking to set up a unified front to get out in the community, to discuss and answer any questions, to disseminate information, and we're going to have even formal educational programs where we go out and talk to groups. We'll have to give pre and post tests to see how people feel about what we're doing. So we're all excited about this. In addition, we want to get the NAACP involved. We would like to help promote their medical education committee, and we're going to move forward with all of these things. So we're all excited. As you know, every year there's an organ donor week every year. This year it's going to be April the 21st through the 27th. And through that, the Kidney Foundation is asking for everyone to go and talk to their church about organ donation on the Sunday of Organ Donor Week. In addition, at the legislative branch, the legislatures, we're asking them to be witnesses for organ donor card signings at the legislative office.
Very good. And Dr. Stevenson, let's talk about Meharry's transplantation program. You're the chief surgeon of the transplantation program at Meharry. Let's talk about that and give us some information about that program.
Yes, in brief, the program at Meharry is actually an integrated program with Centennial Transplant Center. We actually perform the transplants at Centennial Medical Center, and Dr. Faulkner's patients will be placed on our list, and they go through the normal process that occurs nationally. Once the patient's name is brought up as a recipient for a particular organ, that person is transplanted at Centennial. As far as the organ donation projects that Dr. Faulkner and I are involved in, I just want to say that, as you heard her say many times, education, education. The MOTEP is an education program. The Kidney Foundation has an education program. Education is very important. I'm a member of the advisory board at Tennessee Donor Services also, and chairman of the Community Education Committee. Education is very important. The only reason why transplant surgeons do what they do, the only reason why researchers in transplantations do what they do is because people have donated organs. It's unfortunate now that someone has to lose their life in most instances for a person to get a liver, heart, 2 kidneys, and lungs, you know, tissue, bones. It's unfortunate that that has to happen, but that is a fact, that people are dying. And because that is the case, and that there is a need, 10 people die every day awaiting transplantation of organs. I think it's very important that we continue to educate the community so that they will know what the problems are, what misconceptions they may have had, that can be cleared up. And then if you do decide to sign an organ donor card, don't do it in secret. What I mean by that is, don't go get your driver's license, and when they ask if you want to be an organ donor, you say, yeah, I heard Dr. Faulkner talk about that, and you say yes. Then when you go home, you put or before you leave, you put your license in your wallet, and that's it. You have to go home and talk to your family, because even though that card has been signed or that license says what it says, your next of kin has to give consent. And if they knew nothing about it, if you didn't talk to them about it, then the chances are that they would say no. So education is very, very important, and that's what we want to do. We want to stay out into the community, go door to door if we have to, just to get this word out, because it means so much to so many people.
Very good. Dr. Faulkner, how successful, over the last minute that we have here, how successful are transplantations now?
Oh, transplantations are very successful, you know, especially kidney transplantations. We do them every day, and we would do more of them if we had more organs available. Heart transplantations, they're very successful. Just about all the transplantations are very successful with the advent of the new drugs that we have now to treat patients after they've received the transplant. So transplantation, the success is there. We just need the organs.
Dr. Stevenson, how long does it take? Well, and I know different situations might be different, but now assuming that there's a person who has a chronic kidney disease, how long are we talking about working on that person if there's a donor available?
You mean doing the transplant?
Doing the transplant.
The transplant takes anywhere from 2 to 4 hours.
So it's not a long, drawn-out kind of procedure that they have to go.
For kidneys, no. For livers, it's a little bit more involved, anywhere from 6 to 24 hours, depending on what the person's inside anatomy is like. But as Dr. Faulkner said, these are not experimental. Organ transplantation is a daily thing, and the medicines are much better than they were in the past, so the success rate is better. And we just encourage everyone to think about it, because 10 people die every day awaiting organs.
So what we're saying is that both recipients and donors can also benefit from what we're talking about this morning. And let me thank you for giving us that information, and let me encourage you to tune in again next week for another informative edition of Comments. Thank you and good morning.